I think they're definitely testing my science communication skills, putting my talk the morning after the prize winner's drinks reception. And I have to say that, in all honesty, I was quite surprised to receive this award. I join a long list of people that have done some very impressive things. Last year's winner, Professor Lindsay built a model of a gut that people could actually walk through to teach folk about the microbiome. Dr. Lucy Thorne led an incredible public engagement program in Sierra Leone. Prof. Okiki worked on expanding access to microbiology, and Dr. Diane Ishiro-Oradope raised awareness on antimicrobial resistance. These awardees have made an impact on science far beyond their research. And clearly, the women have been dominating this category in recent years, but not to leave the men out entirely, I wanted to mention Dr. Simon Park from the University of Surrey. Simon was awarded this prize in 2015 for his love of microbiology and his love of art and combining the two. And between Simon and I, that is now 2 awardees from Surrey. And I'm just saying, Imperial, we are catching up with you. Unfortunately, I never got to meet Simon, but stories about his work and his art still frequently pop up during our coffee breaks, where some of his incredible art that you can see here hangs on the wall. A reminder to all of us that the work we do really can have a lasting impression. So why do I say I'm surprised to receive this award? Well, I say this not to be modest, but in truth, I have done nothing grand. I haven't established a school club or a scheme or a charity endeavour. I do not have a standalone thing that I can point to and talk about the feedback and the number of attendees and the impact from what it is I have done. My nomination, and not to put words in the prize committee's mouth, but the reason I think I've been awarded this prize is about a sustained contribution to science communication and outreach. And I think this type of public engagement represents a lot of what we all do. Many of us care about science communication and outreach and understand the importance of it, but finding the time to do it can be incredibly difficult. So we do what we can, particularly if we don't have the funding or the resources to arrange these large-scale events. So we do the 15-minute radio interview, we do the pre-record over Zoom, we write an article at the weekend. We do things that we fit around our usual research and teaching activities. And this is certainly something that my nominators do. I would like to extend a thank you to these people who all are involved in science communication as well. To Jill, who not only nominated me, but has provided career support and guidance throughout my time at Surrey. To Ed, my co-nominator, and our new chair of Virus Division, who's done a lot of fantastic science communication recently around H5N1. And Matt, our outgoing chair of Virus Division, who I know has provided a lot of support for several prize nominations over the years. There's also a lot of other people I'd like to thank. Too many to name individually. First off, I do want to say that it means an incredible amount to me to be receiving this prize in Belfast. Queen's here in Belfast is where I did my undergrad degree, my PhD, my postdocs, my fellowships. Honestly, it was almost impossible to get them to make me leave. It's where I not only became a scientist, but where I started doing science communication. I left Belfast for Surrey in July 2022, so most of my science communication I have done, particularly around COVID, was done here in Belfast. And I'd like to start by thanking 2 of my virology colleagues from Queen's, Prof. Alton Power, that's his big face in the middle, and Dr. Conor Bamford up in the corner. The 3 of us, virology at Queen's, we did an enormous number of media appearances during the height of COVID, and having colleagues that were going through the same thing was invaluable support. We understood what this very, very weird situation we were in was, and I know we all felt a certain amount of pressure, but having colleagues in the same boat made it a little easier. It also meant that if one of us wasn't feeling like talking to the media that day, we gave it to someone else. And Alton isn't here this year, so I can say this, that very often Conor and I would chat about a media request and say, nah, let's send this one to Alton. At the top there is Dr. Dean Coey. He did his PhD with us in Belfast. He's an incredible science communicator in his own right. He once wrote an entire rap about TLR4. On the right is the virology department at Queen's the last time the annual conference was in Belfast. And on the left, if you haven't had a chance to go and visit the beautiful Queen's Lanyon building, it really is worth a visit. Brave the rain, go and see it. But the real strength of Queen's lies not in its architecture, but in the people that work there. The support that the virology department received during COVID allowed us to not only continue with our SARS-2 research, but engage with the public and the media, and the comms department in particular were fantastic at facilitating that. I also really want to mention some of my Surrey colleagues. So in the bottom is a lot of my group and my colleague Maureen Petit's group on a day out to an escape room. In the middle here, we have Dr. Danny Best and Dr. Susie Hingley-Wilson at a summer fete where they do outreach every year. And I have to say that before I moved to Surrey, I did think that summer fetes were only things that happened in BBC dramas. Up in the top corner, we have an event that happened recently at a school in Surrey, arranged by Dr. Paola Campagnola. And in the bottom corner here, this is a lot of the PhD students from the School of Biosciences at a recent away day we organised. I am so incredibly lucky to work with people that are passionate about their science. Their love of science and the outreach that they do continues to inspire and encourage me. And I do want to mention as well, this photo of us around a table, this was us playing traitors at Christmas. We even had our own Claudia Winkleman for the day. And I'm not sure how my group feel about this, but it turns out I would make an excellent traitor. I share these images because our job is a huge part of our lives. We have to enjoy it. If I didn't enjoy my job, it would be much more difficult to do science outreach and engagement and encourage other people to like science. And a lot of these people have also been a sounding board for me over the years, reading articles I've written or quotes I've provided, chatting through plans for events we're attending. I believe the best science is done in collaboration with people, and I think the same about science outreach and engagement. We need people to bounce ideas off, to tell us if an idea is too crazy or won't work. And we also need them to provide a bit of support when the idea of writing a prize lecture becomes a little bit overwhelming. So, like with our research, we build on what others have done before us, which is my excuse for hijacking some quotes by some people much smarter than I. So I thought I'd use some of my favorite science quotes to illustrate why I think science communication and engagement is so important, and honestly, one of the key roles of a scientist. Science is not finished until it is communicated, is a quote from Sir Mark Walport, who was the UK's Chief Scientific Advisor from 2013 to 2017. I'm sure he's very grateful he did not hang around in that role for a few more years. This is one of my favorite quotes, and I know the undergrads I teach are probably sick of hearing me say it. But a lot of us are trained to think that the science ends at discovery, at the end of an experiment, at the end of a data set, at the publication of the paper. We are taught to generate knowledge, to test a hypothesis and produce results. But I think this quote reframes that. It tells us that science is not complete until it is shared, understood, and ultimately used. In microbiology, this carries particularly more weight because a lot of the things that we study are unseen, yet they shape every aspect of our life on Earth, our health, our environment, our ecosystem. So if we don't communicate what we know and what we discover, it remains invisible in every sense. Science communication takes many forms, from what we need to do as researchers, presenting our data at lab meetings, at conferences, publishing papers, writing grants, writing your thesis, doing your viva. This is communication in science. It is how we demonstrate to other scientists what we know. And we have all heard the awful phrase, publish or perish, and unfortunately, there is some truth to that. But today, what I'm focusing on is what we, in my opinion, should do, which is communicating and engaging the public in our work, getting them interested and, dare I say, even a little excited in some of the cool things that we get to do every day. My first experience of public outreach and engagement was through becoming a STEM ambassador. This was actually recommended to me by the aforementioned Connor, so if you don't enjoy this talk, blame him, he's over there. He is the reason I started doing outreach events, and as such is partly responsible for why I'm standing here today. Being a STEM ambassador was a fantastic opportunity to get involved with events and science fairs, visiting schools. It was my first experience of science outreach. I got to tell people about my job, I got to talk about science, and I got to tell kids about the careers they could potentially have. And I found that so important because if your school was anything like mine, if you liked science, if you had an aptitude for science, you were encouraged to apply for medicine, and you maybe weren't aware of the breadth of a career you could have. But it was actually getting involved with the Northern Ireland Science Festival that made me fall in love with outreach and engagement. The NI Science Festival is huge. It takes over the whole region for a couple of weeks every February, and is certainly up there in the list of things that I miss about living in Belfast. Every year, the lab would take part in an open day. We would make up games for kids, things like catch a sneeze and build your own virus, and we tried to convince them that virology was pretty cool, with varying levels of success. I also did Bright Club a few times. This is science-themed stand-up comedy, which was amazing fun to do, utterly terrifying, and I'm pretty sure with age and wisdom, I will never agree to do this again. And then in 2019, I arranged this event for the festival called Belfast on the Brink. We got different departments around Queen's: virology, immunology, public health, nursing, pharmacy, medicine, to show what their role would be and how they'd have to work together and collaborate if there ever happened to be an outbreak of an unknown virus. We even roped the drama students into being patients. They were wandering the halls of the university with green splotches on their face, wrapped in tinfoil blankets, groaning in pain. They definitely caused some nightmares that evening. So, of course, at the end of 2019, we all know what happened. And I think because of this event, when producers and journalists started Googling outbreak of an unknown virus, my name kept popping up. So I started getting calls asking me to comment on the outbreak of this unknown virus that had emerged in China. I said no initially and repeatedly because I did not think I was qualified to comment on the topic. I wasn't a professor, and by that point in my career, I had been told I did not sound like a scientist several times, which brings me to my next quote from another one of my favourites, partly because she's a fellow Queen's alum, but Dame Jocelyn Bell Burnell said that people from different backgrounds approach a subject in different ways and ask different questions. We are certainly better now than we used to be at recognising the strengths that come with diversity. There is obviously still room for improvement. Having people from different backgrounds is not just important when we're discussing our research and how we approach a scientific question, but it is so important in science communication and outreach. I'm sure you've heard the phrase, "You can't be what you can't see." And it's true, kids want and need to see their future selves in the jobs they aspire to. It's also important that we have scientists from different backgrounds, different career stages, different life stages, different countries, different roles, appearing in the media. People often want or need to identify with the person that is providing the commentary or advice. If a scientist is from your local community or a similar background, there's familiarity there and potentially shared values or culture, which really helps encourage trust in the message being delivered. And it was a BBC Northern Ireland journalist that helped me realise the relevance of this quote to my own role in science communication and convinced me to do my first media appearance. Mary Louise Connolly is an incredibly straight-talking woman. She got very fed up of me dodging her calls and of my imposter syndrome and said to me one day, quite angrily, "Do you have a PhD? Do you work on respiratory viruses? Right, then why should you not tell us your thoughts and opinions?" And since that first interview, which I have to say is dreadful, I'm pretty sure it's been scrubbed from the internet, thankfully. But since that, I have, and up until I left Belfast in July 2022, I've done over 970 radio, print, and TV interviews and syndications, featuring some of my favouritely named publications, The Scottish Farmer and The Sacramento Bee. But there were certainly a lot more recognisably named news outlets that I worked for, and I don't like looking at these or even thinking about it, because if I do, looking at the circulation of these interviews and the number of people that may have heard what I have said can be a little bit overwhelming. But it also means that potentially someone listening has been interested in your message. You may have made the difference in someone listening to public health advice, or getting vaccinated, or even just finding science interesting. The interviews I have done have made it to nearly every corner of the world. And it's very important to remember that you might be talking to a diverse group of people and people that may not have a science background, but that still really want to know what is going on in the world. And that brings me to my next quote by Sir Albert Einstein. If you can't explain it simply, you don't understand it well enough. Science is complex and messy. There are exceptions to every rule. It is changing and evolving. And this was something that was so apparent in 2020. What we said in the media one day may not be completely accurate a month later as we learnt more. But it was so important for us to try to distinguish the signal from the noise, to identify what really mattered. What do we want something listening to an interview or reading an interview to take away from it? I will say, I don't think I always got this right. I don't think anyone does. Someone will misinterpret what you say. A journalist will take a section of an interview for a headline that potentially doesn't represent the whole vibe of the interview. And this made me quite a lot more careful about the outlets and the journalists that I chose to work with. And I don't think that is a bad thing. Thankfully, my experiences of working in schools and science festivals really trained me to be able to handle difficult situations and difficult journalists. There is nothing harder than answering questions from a curious 6-year-old. And that training in science and science festivals really helped me understand how to simplify a topic, as did writing articles for The Conversation. This helped me understand that balance between simplifying a topic so it's understandable to the majority of people without crossing a line into being patronizing. The editors I've worked with at The Conversation are so fantastic at pointing out when something is too complex or you need to explain something further. And I would say to anyone that wants to get involved with science communication, this is a great place to start. You can pitch an idea to The Conversation. It allows you the space to discuss what you want with the advice of those editors. And often, if your article takes off, if there's interest in it, it starts to get republished by other news outlets, it starts to get quoted in the media, and suddenly you're a science communicator. So another difficult balance to achieve with science communication is the balance of caution without causing fear and optimism without causing disregard for safety. Which brings me to this quote: "Nothing in life is to be feared, it is only to be understood," by Mary Skłodowska-Curie. This was incredibly important during COVID. We got accused sometimes of either fear-mongering or downplaying an important event or issue, sometimes based off the same interview we have just done. And I will admit it was incredibly frustrating. Working in a Cat 3 lab for hours a day, wearing a lot of very uncomfortable PPE and a very heavy respirator, to then go and do a radio interview where I might be debating someone that thinks the public health advice was too extreme, or that we should just let the virus spread as widely and as quickly as possible, and even on occasion debating people that didn't think viruses were real, all while still having the indentations of a respirator on my face. But the balance between caution and optimism is crucial when we are discussing anything when you know people have suffered or even died as a result of what it is we are talking about. And this goes far beyond COVID. This is important to remember in any aspect of research and communication. The virus I primarily work on is called respiratory syncytial virus, RSV, which if you were in Antonia's talk yesterday, you will have heard a little bit about. I have worked with some government organisations and patient advocacy groups and support groups on education around RSV and other respiratory viruses, because despite RSV infecting virtually everybody before the age of 2, it is still not that widely known about. For most children, RSV is a very mild respiratory symptom, but for some, it can be very serious. It's responsible for around 3.6 million hospitalizations and over 100,000 deaths in children under 5 worldwide every year. Now, this data is something I would present, for example, if I'm discussing the importance of the newly licensed maternal RSV vaccine. It highlights the seriousness of this infection and the impact that preventing that infection could have on reducing those hospitalizations and deaths. But RSV is also correlated with the development of childhood asthma. And those that have childhood asthma have a 32-fold increased risk of developing COPD in later life. And while this link is scientifically fascinating to me and something that my lab are focused on researching, this data is something that I would not present to a patient advocacy group of parents of children who have recently suffered from severe RSV infections. And I'm sure you can understand why. Telling parents of children that have been very ill that they may have lifelong consequences is not what they want or need to hear at that point. But this data is definitely something I would and have presented to policymakers, showing that if we have early intervention for something like RSV, we can have a lifelong impact on a person's health and in turn reduce the economic and healthcare burdens of long-term health conditions such as asthma and COPD. Knowing your audience, tailoring your message to the audience is critical in science communication, not just so the message gets through, but so we have empathy for the people that have suffered from the illnesses caused by the things we research. We should always remember that the statistics and figures of morbidity and mortality represent real people. And I have to say, the whole representing real people thing, sometimes people forgot that during COVID, the scientists and the commentators in the media were real people. And that brings me to my last quote, one that I'm not going to read out, and not from a famous scientist, but from a scientist nonetheless. It would be amiss of me not to mention the downsides that come with public-facing science communication. If anything you do gains a certain amount of engagement, it comes with a few side effects. This was certainly heightened during COVID, and thankfully the science communication I do now comes with a lot less drama, and it took me a long time to heed the advice of journalists and stop reading comments like this one. And I'm not going to dwell on the negative, mostly because I don't want to put anyone off getting involved in outreach and engagement. And I will say that if your university or institute or company, wherever you work, has a comms office or a press office, this is one of the areas that they really can help provide support. I was very lucky when at Queen's to have supportive colleagues, not just in virology and in the comms office, but higher up. The head of our institute, Prof. Jose Bengachea, and our head of faculty at the time, Prof. Stuart Elborn, both reached out to me to make sure that I was okay. And knowing that you have that level of institutional support and that level of public institutional support is invaluable. This was actually published in a newspaper, basically Queen's saying they support what the virologists are doing. And if it is of any reassurance to anyone considering getting involved in SciComm, the positives most certainly outweigh the negatives. Being involved in science outreach and engagement has provided opportunities and experiences I never thought I would get, and I hope I will never take for granted. I've been able to meet some amazing people, and I've done some incredibly weird and wonderful things. I've been involved with the creation of a mobile phone game. I gave a TEDx talk on science communication, and I even provided scientific advice to a zombie TV show on Channel 4. I will say, I'm not sure they listened to any of my advice. And the first question they asked me was, which virus is most likely to give a person telepathic powers? And I'm not going to tell you my answer. And while I said at the start of my talk that it's difficult to gauge the impact of the type of science outreach and engagement I do, it's this image in the middle that is really the only measure of impact I need. This photo was sent to me by a friend that was visiting secondary schools with her daughter around Belfast, and this was on a display of female scientists. This is a school I didn't go to. It's a school I have no connection to, but here I am on a wall next to Dorothy Hodgkin, really reminding me that the impact we have goes far beyond our own circle, and we really, truly cannot know the impact of our outreach. So I wanted to bring it back to this quote, "Science is not finished until it's communicated." If you take away anything from this talk, don't remember my words, remember Sir Mark Walport's. Communicate your science. Tell people about the amazing and fascinating work you do. Tell them that science is flawed and imperfect and constantly evolving, but it is how we make progress. I wanted to also get the input from some of the advocacy groups and policymakers and journalists that I've worked with over the years about why people like us engaging with the media is so important. So after this slide, I have a video that I want to share with you. But before I play that, I just want to say thank you again to the Microbiology Society. I've been involved with this society from the first year of my PhD. I was a champion for many, many years. I was the Young Microbiologist of the Year in 2016, as it was called then. And I'm now a member of Virus Division. The Society has been a constant throughout my career, and I'd like to continue to be involved for many years to come in whatever capacity they will have me. And I will also say that nominations for next year's prize lectures are open, so get thinking, get nominating. Okay, so I'm going to play the video. I will say I did not ask anyone to name me in particular, and Silky, who is an amazing woman in the first video, has given me quite the promotion. I am still not a professor yet, but this is their impression of why science communication from scientists is so important.
Hello, my name is Silke Marder. I'm the chairwoman and the co-founder of the Global Foundation for the Care of Newborn Infants. We have worked over the last years with Professor Lindsay Broadbent, and I'm very happy to congratulate her today and also you for the decision for her Outreach and Engagement Prize. She has supported us over the last years to raise awareness on RSV, how to prevent, what is RSV, and what can we do to really stop RSV infections, to inform the public about it, to inform parents, parent representatives, but also healthcare professionals, how important it is to raise awareness on RSV, to educate and train healthcare professionals with a webinar, but we also have involved Professor Lindsay Broadbent with a campaign raising awareness in the public for patients, but also policymakers to make decisions on preventing RSV, a disease which kills babies, also adults and elderly people, chronic diseases, people with chronic diseases, and this is something where she is really an outstanding person who is bringing scientific, high research content into a lay language, understandable, and spread the message. Working together, eye to eye level, is something what Lindsay has done with us over the last years, and she has more than deserved this wonderful award. Thank you so much, Lindsay, for all your work, and thank you for you in the audience for giving her this wonderful award.
Hi, I'm Vanessa. I'm a media officer at the University of Surrey, and I come from a broadcast background, having worked at stations like Heart, LBC, Greatest Hits, and more. So in an era of fake news and clickbait, your expertise genuinely matters, and my years in the newsroom has shown me exactly why. A few examples: during the COVID pandemic, I was constantly turning to virologists to help our audiences make sense of what was unfolding. When the cost of living crisis hit, it was economists who first explained inflation and the wider socio-economic impact. And through every political leadership transition, and there were many, university experts across the country stepped up to cut through the noise and provide clarity. Now, in my comms role, my biggest challenge is often convincing academics to step outside of their comfort zone and engage with the media, but when they do, the impact can be huge. You're not only raising your own profile or your universities, you're actually providing a real public service by strengthening the accuracy, balance, and integrity of the news.
It is important that scientists engage with policymakers and politicians to ensure that their up-to-date research, particularly in the medical field, can help to influence and inform policy, legislative and funding opportunities to ensure that the most up-to-date health outcomes for all our communities, whether in the area of vaccinations or cancer treatments and therapies.
My name is Tom Sheldon and I work at the Science Media Centre. Our entire job is fighting misinformation in the news, but we can only do that with the help of research scientists. Think about all the stories you read and hear every day: driverless cars, vaping, climate change, antidepressants, weight loss jabs, genetic editing of food, geoengineering, vaccines, microplastics. The list is endless and varied. But these stories underpin public understanding of science, and if they're poorly informed, then so are the public. We're lucky in the UK to still have a lot of specialist science, health and environment journalists across the big national titles, but they're under a lot of pressure to produce more content across more platforms. They have to make the stories interesting, but most of them also want to get the facts right, while constantly being pulled in different directions by politicians, campaigners and companies who are queuing up to influence them. Journalists can't do that job on their own, and that's where scientists come in. By engaging with those journalists on the most contentious, contested and controversial subjects of our time, by writing quotes and being available for phone calls and interviews, the research science community plays a unique and vital role in challenging false claims and keeping the news media accurate. Science doesn't exist in a vacuum or end when a paper's published. Scientists need to be out there informing the public by engaging with the media. Because for much of the public, that's their main window on science, and we can't afford for the news media to be full of misinformation on such crucial subjects as these. If we allow misinformation to undermine public trust, belief and understanding, we're undermining science itself.
Hi, my name's Stephen Rainey and I present radio programmes for the BBC. And during the pandemic, I was presenting a radio show that was bringing up-to-date information about the pandemic to our listeners here in Northern Ireland and beyond. And it was so crucially important to hear from informed voices, from scientists, from experts, from people who knew that what they were talking about. This was a period where there was so much conjecture, there was so much misinformation, that it was really important to get to the facts, to get people to understand exactly what they needed to know without relying on decisions and information that would be bad and harmful for them. That's why it was so important for me to turn to experts who could clearly articulate what we needed to know. This was a confusing time. There was a lot of things that were quite difficult to understand. So the benefit of having science communicators who could really put across complicated ideas in a straightforward fashion, you can't put a value on that. That's why I think it's so important that people are able to communicate science and ideas across to people in the media. We have a responsibility to keep people informed, and we rely upon experts and scientists.
Hello, my name is Mary-Louise Connolly. I'm the BBC's Health and Social Affairs correspondent in Northern Ireland. I first met Dr. Lindsay Broadbent, like many people, during the COVID pandemic, working in Northern Ireland and trying to explain, understand what was going on in the world and applying it to Northern Ireland. Well, Lindsay was my go-to. Lindsay made herself available to the media, to journalists like myself. I would turn to her to simplify what was extremely complicated at the time. Something that was really baffling the public, journalists, doctors, nurses. And somebody like Lindsay could explain the science behind it all. And that's what we wanted to hear. And Lindsay was always at the end of the phone. I would always text her first, Lindsay, I need you, I need your brain, I need you to explain something. And she was brilliant. And it's so important that people like Dr. Lindsay Broadbent is available, not only to journalists, people like me, but also to Joe Public. Because through Lindsay, we get to understand what's happening in the world around us. And that's just, you cannot buy that. And Lindsay, we missed you in Belfast, Northern Ireland, but we always know you're just a phone call away. Good luck.
Hi, Lindsay. I just wanted to say that in the media, we are so indebted to the scientific community on many, many occasions, preventing us overplaying stories. That does happen from time to time, and even sometimes emphasising the importance of things so we don't underplay them. And you and other virologists and infectious diseases experts were always really, really helpful during the worst of the pandemic, just in putting us right, guiding us through the data and so on. And all credit to the Science Media Centre for being there, running briefings on difficult subjects, new papers and research and so on, and especially providing reactive comment rapidly to breaking stories. Where would we be without it? So a big thank you from the media to all you scientists out there who've helped us on so many occasions.
Hello, I'm James Gallagher, the BBC's health and science correspondent, and I present Inside Health on BBC Radio 4. And it is vital that scientists engage with the media, because if scientists don't, then who are you handing the microphone onto? Who is filling newspaper column pages, TV bulletins, if it's not scientists, if it's not specialists in their field? And this is really important. Take COVID, climate change, current discussions around levels of autism and ADHD in children. If that expertise is not part of the discussion, then this feeds into the country and the world we live in. So it's vital that scientists take part. And I would say, having interviewed hundreds of scientists, most of them actually enjoy it.
Hello, I'm the presenter Colin Murray, and in an age of so much noise, a deluge of opinion and often misinformation, to make sure platforms exist for expert voices to cut through is vitally important. It doesn't mean Lindsay, for example, or others I've worked with have all the answers. Science is, after all, as much about questions as answers, and possibility and probability, but it's the meat on the bone. It's that calm voice that doesn't dumb it down or hype it up. It's expertise, and just as important, it's reassurance, but it needs to be communicated. It has to engage. Good science without good communicators is like great music without speakers. People just won't hear it. So well done to Lindsay and to all of those who put their faces and voices out there in the name of science and logic.